With the emergence of a new COVID-19 strain and rising concerns about the Marburg virus, public health officials and experts are sounding the alarm on the critical need for preparedness and preventive measures. As global health systems work to address these challenges, the focus shifts to Nigeria's readiness to combat the spread of these highly infectious diseases. How equipped is the country to detect, respond to, and prevent potential outbreaks? What strategies, resources, and policies are in place to swiftly contain this threat and safeguard public health?
Welcome, everyone. With the emergence of a new COVID-19 strain known as the SEC coronavirus subvariant, there is a need for Nigeria to be more prepared for any significant outbreak that may occur, even though at the moment we don't have this variant present in the country. Welcome to another episode of NESG TV. And today we'll be discussing Nigeria's defense against emerging diseases. We have here with us today Dr. Ayodele Cole Benson. He's the chairman and medical director of Ecolab Radiology and Laboratory Services. He's also the thematic lead for Health as a Business in the Health Policy Commission of the Nigerian Economic Summit Group. You're welcome, sir.
Thank you for having me.
Thank you, sir. So, sir, SEC, it's a new variant, basically, of the coronavirus. And we know how COVID-19 basically shut down the world at a point in time. So let's educate our listeners and viewers. What exactly, can you give us an overview of what this new COVID-19 variant is? And also bearing in mind that our East African neighbor brothers, also suffer from the Marburg virus. So just give a short overview of both the COVID-19 SEC variant and, the Marburg virus.
Yeah, so the new variant, that especially the one impacting China presently, called that's the human metapneumovirus. It's a variant of the COVID, like you said, coronavirus, but then we understand currently it's impacting more on children and also the elderly and those with underlying conditions, immunosuppression and the likes, so, but the difference, a little bit of a difference with the other coronavirus that we suffered in 2020 is that this seemed to have predilection for temperate regions, regions with very cold weather. So perhaps that's why we're not having that impact here presently. I understand that presently, Canada, for instance, for some months now, has shut its airports to flights coming from China because they don't want to, import this into their country. So, yeah, so it's called the HMPV, okay, which is the human metapneumovirus, okay. What it does, it gives similar symptoms like COVID-19, basically fever, cough, sore throat, catarrh, congestion, and sometimes an individual may have wheeze, depending on the severity. Even breathlessness may happen. Some people end up developing frank pneumonia in the chest and all of that. Age predilection, like I mentioned earlier, under 5s and the very elderly and immunosuppressed. So that's the pattern that we're seeing presently.
All right. Thank you very much, sir. So I heard you talk about the virus having a predilection for temperate climates, and so that sort of shows that the likelihood of the infection coming to more
to
hotter regions,
it's
it's sort of less.
But then when we're talking about what is it called now, a respiratory infection that is transmitted by airdrops or particles, you never can tell. You understand? Because when you have this circulating in a confinement, like in an aircraft cabin, for instance, and it travels all the way. The immunosuppressed, those that are, immunocompromised for one reason or the other, maybe by reason of illness, maybe by reason of certain treatments, maybe by reason of age and the likes, may end up, picking this infection because the body defense mechanism is weak in the first place. So you never say never in medicine, is even though the predilection is for temporary regions, but there's still the need for caution. You can't rule away the need for caution. Yeah.
Okay, thank you very much, sir. So I hope our audience, our listeners and viewers can hear that irrespective of the fact that this virus, is more predominant in, temperate regions, we can still have it here. But now let's go to the next question. How equipped do you think our healthcare system is to handle some of these cases? Even though, we don't have a predilection for it, but in situations where we have people that have it, within Nigeria, within our healthcare system, how prepared are we to tackle, these diseases, to reduce its spread, and to also ensure that, people that have it, conquer the virus?
Yeah, so when you're talking about preparedness, I just mentioned a short time now ago that Canada, for instance, shut its borders to flights coming from China for some months now. That's part of that's part of caution, operating on the line of caution. We are not such a country, Nigeria is not such a country that we take those type of steps, early on. Because don't forget, we're in a low resource environment. So resource allocation is very important, you have diseases that are already causing problems. You have shortage of healthcare workers. You have shortage of not only personnel, but you also have shortage of other materials, related to healthcare. Now, to channel that resources to a disease you are still speculating whether it will happen or not happen, it's not the way we do things in this part. You understand? We're much more reactive in that sense. We're much more reactive. We want to react to the situation rather than prepare for such emergencies. Okay? So presently, I can tell you not a whole lot is going on in terms of readiness for such occurrence. Okay? Because we are busy deploying available resources to the ongoing issues, that are impacting the health system to start with. The other non-communicable diseases, the cancers, the hypertension, the diabetes, the things that are, killing people daily right here at this moment, those things are receiving more attention than the public health sort of occurrence that are, being under the radar. We're just watching to see whether they will happen, will they come here or not. So we are not, in that sense, putting some strategic steps in place just in case it happens. So what we do normally is that if it does happen, then we will mobilize resources. We will divert resources quickly to tackle. But in terms of preparedness, maybe already going ahead to create isolation wards, already going ahead to strengthen our port health systems and all of that, I don't think that is going on presently. Even the National Orientation Agency, for instance, is not talking about this disease by any means. Again, you don't want to scare the population. You don't want to create fear and anxiety out there. You saw what happened with COVID. And because eventually you are not even sure whether the disease is going to come here or not, okay? So this is the way we commonly treat such situations here. Is it the right way? I'm not sure. But I think what should have been a good approach for now, even though it's not here presently, is to continue to sensitize the population about what is going on elsewhere. Nigerians travel to China, for instance. They travel and come back, with flights coming in. We should be able to put up some surveillance system in place the way we had it during COVID, at least to monitor travelers that are coming in from that part of the world. We should be able to implement such surveillance, or put up a testing system that makes us screen people who are coming in from the geography where the disease is already happening. You talked about Marburg. Marburg is already happening in Tanzania. Okay? Therefore, how are we monitoring that situation locally to be sure that that disease is not imported into the country eventually? So I think there should be such steps, proactive steps, that should be taken by either the NCDC or the Ministry of Health to begin to put some port health system in place to monitor those conditions, conduct proper surveillance. I was in Kigali recently, and the Minister of Health was talking about how they use robotics, to track some of these occurrences, and also to ensure that they nip things in the bud. They actually conduct screening of the waste products from all airlines coming into the country as a proactive measure. That's in Rwanda. So those are the kind of things you would expect Nigeria to do. Be deliberate a bit in some of these actions. I know it costs money, and like I said earlier, if you don't have all the resources, the tendency is that you're going to channel the resources to where it is most needed at the moment. Yeah.
Yeah, thank you, sir. So you talked about the National Orientation Agency.
Yeah.
Even though we may not have the resources, to channel to some of these measures at the moment.
Yeah.
But in terms of public health awareness, like we know part of the role of the National Orientation Agency is to conduct public health awareness. But how do you think the private sector now can help with this? If, let's say, the resources are not available from the public sector side, can the private sector key in to some of these public health awareness campaigns?
Well, of course, the private sector is not operating in a vacuum. The private sector is operating in the economy as it is today. And just as it is in the public sphere, it is also in the private sector. So the private sector operatives today are grappling with the issues of keeping afloat, okay, paying their bills to keep the doors, to their services afloat. So I'm not sure that a whole lot of private sector organizations will devote funds, into a national orientation, for a possible outbreak. It's not a core mandate of the private sector. But having said that, there are non-governmental organizations, foundations, that operate in this space. Sometimes you find those foundations renovating health centers, re-equipping health centers, and some are even adopting health centers in local communities and making them functional. Now, such non-governmental organizations that are focused on healthcare can actually then support the National Orientation Agency in the public awareness we're talking about. Okay? Stimulating the public again on the issues around hygiene, on the issues, around cleanliness, on the issues around people not clustering in very densely congested spaces and all of that. These are things that such private sector organization, non-governmental organization that can afford it should be able to support the National Orientation Agency with. It's all about radio programming, TV ads, and things like that, that we sensitize the public, to say, well, we don't have it yet, we're not hoping to have it, but it's always better to err on the line of caution. Therefore, as we did during COVID, maintain personal hygiene, wash your hands frequently, like the Marburg, virus, like you mentioned, which is in the same family with the Ebola virus. Okay, so this is contracted through blood contact, body fluid, body tissue contact, and all that, and also contact with materials that are contaminated with body fluid or blood or tissue from an infected person. So when you touch the handle of a door, not knowing that somebody else has deposited something there, you go ahead, you shake the next person you're meeting and all that. You're transmitting. You're transmitting. So that's why frequent washing of hands and maintaining cleanliness with the sanitizers and all that is very key when you're monitoring a disease condition like we're seeing in other parts of the world. You're monitoring to be sure that it doesn't get to you here. So we need to play that role in terms of cleanliness, in terms of hygiene, in terms of surveillance as well. And to your point, in terms of national orientation, keeping the information out there in the public domain so that people will even have an idea that something is up, in the air somewhere. It may not be here, but we need to be careful.
Thank you very much, sir, for that response. And I believe our viewers have learned a couple of measures in terms of how to ensure that they don't become transmitters of this disease in the event that it comes to Nigeria. Okay, so moving on, there has been a lot of talk about local vaccine production. Since the inception of this administration, they've been looking at ways and measures, for local vaccine productions. So, sir, do you think at present we have ongoing research, maybe not specific for viruses, that fall within the coronavirus family, but do you think we are making measures, for local vaccine production within the country?
Yeah, several administrations before now have tried to do one thing or another. I recall around 2015, thereabout 2015, 2016, the federal government went into a PPP arrangement with May and Baker to resuscitate the yellow fever vaccine, complex in Lagos. But that venture has, not really taken off as one would expect from that time till now. Again, I go back to the issues around resources. So yeah, research, is going on here and there, definitely, but at the level those researches are happening, you don't expect much in terms of output in a short time. Now, vaccine production requires lots of funding besides the expertise that is required. Okay, loads and loads of funding. So for you to research into vaccine production and then go ahead eventually to roll out production, it takes a lot of resources, which government at the moment has not gotten to commit, and private sector cannot wake up and commit into vaccine production based on our today's context, in the way our call it our purchasing policy is structured. Yes, we had a vaccine policy that was signed up by the ministry, I think 2021, 2022, my memory serves me right, I think it was 2021 after the outbreak of COVID, the shortage of vaccine that happened across the globe. So there was a vaccine policy, a local vaccine manufacturing policy that was crafted and signed up by the ministry within that period. Part of it is to give incentives to local manufacturers and all that. But then vaccines are not medicines that you keep on the shelf. Okay? So the only way you can manufacture vaccines and as a private sector operator and then hope to do good business out of it will be to have guaranteed offtakes. So you must have guaranteed offtakes. And who is the offtaker? Usually, mostly is the government. But today, based on our vaccine financing mechanism, which is majorly through Gavi, the Global Alliance for Vaccine Initiative, it becomes difficult to even patronize a local, assuming you have a local manufacturer today. That local manufacturer has to meet WHO standards and benchmarks, which even the existing pharmaceutical, producers today in Nigeria are finding difficult to meet. So Gavi also has a pact with UNICEF for purchase of vaccines. So even if you produce, you're most likely going to compete with UNICEF for, that offtake agreement. You understand? So a lot of things still needs to be ironed out, before local vaccine production can take center stage in Nigeria. First, funding, access to affordable finance is important. We have, pharmaceutical manufacturers, that could easily extend their production line, to include vaccine production. But that requires funding. You require funding to set up, you require funding to keep that production line ongoing. Then you need concrete offtake agreement that is irrevocable, more or less, to be able to produce and sell for many years. So where you don't have such offtake agreement on ground, you are not likely going to be able to access funds, because you can't produce vaccines and keep on the shelf. Nobody is going to come there to buy it. You understand? Even the authorized vaccines, common authorized vaccines like the hepatitis, the typhoid vaccines, and the few vaccines that are authorized locally that are sold in the local pharmacies. What is the demand? Do you understand? Vis-a-vis the purchasing power of the average Nigerian, what is the demand? So that's why local vaccine production is still a tall order as it is today. Now, what can easily happen is if we begin to craft government engagement, whether at the federal level, maybe through the National Primary Healthcare Agency or the Federal Ministry of Health itself, for vaccine purchase locally to stimulate the industry. It has to be a deliberate effort to stimulate that whole local vaccine manufacturing industry. And what will be catalytic in that sense will be offtake agreement, long-term offtake agreement with whoever is the private sector player that wants to venture into that space. Of course, benchmarks must be given, standards must be upheld. What will happen quickly will be that such manufacturers will simply go overseas, create partnerships with the likes of, industries that are already in that space, and bring them into Nigeria to begin to produce alongside, because there's already a ready market. But where the market is not there in terms of offtake, production will be difficult.
Thank you so much, sir. So, as we say, there's an important need for collaboration between the public and private sector when it comes to vaccine production, so that the private sector, investors can actually make their money, after investing into this sector of vaccine production.
Yep.
So, sir, let's go back a little bit.
Okay.
We're looking at Nigeria, has had Ebola. We had an Ebola epidemic at a point, and COVID-19, and our rapid response protocols to this epidemics was quite lauded worldwide. So in the event that we have an outbreak of SEC, what do you think should be our rapid response protocols? Should we stick to the same, response protocols we used for Ebola and for COVID, or are there things that we need to add to these response protocols, sir?
Well, the only other thing that you may want to add, maybe we'll rehearse what we did before we talk about adding. Okay, so what did we do? You understand? What did we do right? We joined the world in practicing isolation. We joined the world in wearing face mask. We joined the world in maintaining hygiene, social distancing, and the likes, okay? And that worked. We also joined the world even in surveillance in terms of contact tracing, okay? Following up on individuals who have been exposed to the condition and the contacts of those individuals to see how they are faring and all that. So we did all those and it went well. Can it be enhanced? Yes. Today, with the aid of robotics and AI, you can actually make that a lot more efficient. So even by so doing, you can reduce the amount of human interface that is required in the overall process of contact tracing and the likes. Data management can also be better conducted than it was done previously. But I think we should be able to applaud ourselves in the things that worked. The other thing that worked during COVID-19, for instance, is the public-private collaboration in testing. For instance, there was a time that the government institutions could no longer, cope with the volume of testing requirements, and then private sector came in and, expanded the whole testing platform. So that also is something that can be expanded upon, assuming there is an outbreak of, any of these communicable diseases in the future. Private sector will always rise up to the occasion if you give them the mandate to do so. Okay? We didn't have any lab, apart from one or two. I remember Gene 54 in Lagos then, and one other lab probably, that were ready to test COVID from day one. But at the end of the day, before COVID fizzled out, we had over 150 labs accredited to test COVID. So my point is, you give the private sector the mandate, they always rise up to the occasion, okay, with that public-private collaboration, where the private sector is certain to recoup whatever investment is being made into the sector at that moment in time. So if you give the private sector, a mandate to take any of the roles along the value chain of, disease prevention, for instance, around that whole, complex, and then show them where the returns on their investment will be, they'll take the challenge. They'll take it up. You could decide today to privatize your port health system. So it's no longer in the public domain. And then private sector, laudable private sector organizations now take over the management of your port health systems. So whether it's your land borders, air borders, and sea borders, the private sector will do wonderful work, just like it did during COVID in that sense. If you want private sector to deploy AI facilities, artificial intelligence facilities, robotics, into contact tracing, disease surveillance, and the likes, and data gathering, private sector will do it. But having made that investment, they must see the pathway to return on the investment, because this is investors' funds. Even if you're going to the bank to borrow money today, you know that we're dealing with commercial lending rates that is, close to 40% per annum, 30-something% in the most part. And therefore, having borrowed money at close to 40% interest, you need to do a very good return on investment to be able to repay back that credit. So if you're engaging the private sector to mobilize resources, in some of these preventive or public health system management, then you need to show where the return on that investment will come from. Yeah.
Thank you so much, sir. So in as much as we are talking about public-private partnerships, it's also important to know that the private sector needs to get return on investment, considering commercial lending rates and the likes. So sir, let's look at the key challenges that we can face as a country in preventing these diseases. We earlier talked about public health awareness campaigns, how that can help. But what are some of the challenges that we face, in preventing and containing, viruses, in general, these diseases? And what are your suggested measures now for government, to address some of these challenges?
Well, some of the challenges, government can provide solutions, but some are difficult. Okay? So when you talk about respiratory diseases, for instance, most times you have clusters of high density populations where in a room, say 12 by 10 or 12 by 12 size room, you have 6 to 8 people sleeping in that room. Okay, everybody's just finding his or her space overnight. So containing, disease in such environment will be difficult because these are people densely packed in a closed environment. Okay, you go to the market, you go to the garage, you go to these public places, and you want to practice social distancing. There's not a whole lot that can be achieved in those places. But when there is a disease outbreak like we handled it before, you could have all those mask mandate where it becomes mandatory for people to wear masks in public places. Once you're outdoor, you must wear your mask. Once you're going into a public environment, you must wear your mask and the likes. So government can put such mandates, okay? And it works. Government can be deliberate also in ensuring that healthcare workers apply and adhere to protocols on the line of care. Do you understand? Because there is also hospital-based transmission, health workers transmission to innocent, members of the public. So where you have a healthcare worker, for instance, using the same pair of gloves to attend to 100 patients. And you are managing some of them with communicable diseases. Yes, you're wearing gloves, quite all right, but you're not preventing anything. You are still transmitting. So healthcare workers, making appropriate use of the personal protective equipment will help also. And that is something that government can mandate and government can provide for, especially in public health institutions. But when you go to a typical general hospital where the resources are low, like I said, and people are managing what they can find to work, you see patients sharing a lot of things. You see patients sharing things that should not be shared. Okay, sharing closed spaces that people should actually be isolated. So, that's why I said, in the context of our own environment, some of the measures are difficult, but some are possible. So we start from what is possible and then address what is difficult as they come along. But you can't just wake up and decide how many people will sleep in a room in a densely populated environment. Do you want them to sleep on the street? Yes, no. Okay, that's the room they have, and that's where they must sleep. So some of the measures are practicable, some are not. How you conduct yourself in public places can be controlled by mandates, by legal framework, whether at the airport, seaport, banks, schools, hospital, public places generally. Government can mandate certain personal hygiene measures, certain social distancing measures, certain, measures that will not allow individuals to come into contact with the virus in the first place. But that's, the extent to which government can, apply itself. But most of the time, there are areas where they cannot apply themselves.
Okay. Okay, thank you so much, sir. So you are the chairman and medical director of Ecolab Radiology and Laboratory Services, and from the name, we know your company offers radiological and laboratory services, for the nation. So, being the director, what impact do you think your complaint has had, in terms of public health awareness campaigns, in terms of sensitizing people, and in terms of reducing the disease burden of the nation?
Well, thank you for the question. By God's grace, just 2 days ago, 22nd of January, made it 26 years of our practice, in the local market here, where we started to render diagnostic services from Kaduna, and then, of course, then came into Abuja and went on to some of the southern states. Today, we run 12 branches across 5 states and the FCT, okay, employing well over 200 full-time staff and, of course, the part-time ones as well. And then offering services to thousands and thousands of Nigerians, every year. And some of the services we offer are services that are not commonly available everywhere you go. So to that extent, we have played major roles in bridging some of the gap in the healthcare ecosystem in Nigeria. In terms of public health awareness, we conduct webinars, from time to time. And of course, we invite the public. We have a community of practitioners, doctors, and the likes that attend our webinars. Our webinars are usually always, well thought through. Sometimes we're dealing with issues of cancers of different types. Sometimes we're dealing with other public health conditions. So by so doing, we create awareness. Sometimes we also participate in outreaches, okay, outdoor outreaches. Either we're working with an organization or we're working with an individual who wants to conduct medical screening and medical testing like that in his or her community or in a selected environment. So by so doing, we also participate in some public health sort of schemes. To let you know, over the period, we have also had PPPs. At some point, we ran the radiology department of Delta State University Teaching Hospital. At some point, we were at the General Hospital in Isolo, also in the radiology department. At some point, we were at the Asaba Specialist Hospital in Delta State, also running both laboratory and radiology services and the like. So we've always participated with government, here and there in executing projects, in executing, testing, okay, either by way of PPP or by way of medical outreaches. We do mammograms, we do all those type of tests that people come to obtain, especially during the cancer week or cancer month, and all of that. So for 26 years and counting, by God's grace. So we've done our bit, and we continue to explore opportunities to do more. Okay. We do, at some point, we were on radio. At some point, we sponsored programs, on TV, radio, local televisions, radio. I remember back then in Kaduna, severally, I used to appear on NTA, Good Morning Express. I think that's what it was called. Yeah, morning, the AM Express show. AM Express, yeah. I used to be a regular person on that show back then and all that. And it's all about public health services. At some point, I was the state coordinator with this foundation that handles reproductive health. What's it called now? There's this foundation that handles reproductive health, and I was the state coordinator in Kaduna back then, okay? So we've played our roles, and we continue to look for opportunities to interface with government in public health awareness and in public health programming. Yeah.
All right. Thank you. Thank you so much, sir. We've had with us here today Dr. Ayodele Cole Benson, is the chairman and medical director of Ecolab Radiology and Laboratory Services. He has enlightened us on the key roles that we as citizens and the government and the private sector needs to play in ensuring that we limit the spread of any virus that enters, especially as it pertains to the SEC virus. And what are some of those measures? We've talked about good personal hygiene. washing of hands, and for government to tighten up measures, from all ports of entries into the nation. Thank you very much, sir, for coming on this wonderful episode and helping to sensitize the public.
Thank you for having me.
Yes, sir. Thank you, sir. So my name is Sheriff Aderibigbe. Until next time, have a great day.